Good morning. It's morning yet. So greetings from sunny Chisinau. When I left Chisinau for Sarajevo on Monday, we had 18 degrees minus, but unfortunately we had less snow than in Sarajevo. Thank you for inviting me to share with you Moldova's experience in scaling up quality ECD services nationally. I'll skip. So, could I have a microphone? Moldova is the poorest country in Europe, and thank you. And currently is going through quite a difficult and long transitional period. Beside that, or regardless economical difficulties for the last couple of years, as you could see here, the Moldovan authorities could ensure a steady increase in investments in education. However, regardless of this increase, the enrollment rates in upper secondary education and primary education decrease. And the only progress that was registered was the increase in early education. So I can tell you also that the bulk of money from this increase went for teacher salaries. This was behind the increase. So I'll tell you a little bit of history. In 1990, Moldova got its independence from the Soviet Union. And 10 years after that, as a follow-up, we had a deep decrease in enrollment in early childhood education. So, which were the causes? The number of preschool institutions decreased by 1/3. Some of them were sold, some of them were privatized, and some of them were simply closed. The number of educators decreased by half, and which is really, really very sad. The enrollment rate in ECD dropped by 57%. So, using that data, UNICEF, in cooperation with UNESCO, started an evidence-based advocacy to convince the government to focus its attention on early education and care. And in 2002, for the first time, Moldova declared early education as a national priority. After that, step by step, starting with 2002, early childhood education and care was mainstreamed in our major governmental developmental strategies and also became a priority for international agendas. So in 2006, Moldova became eligible to Fast Track Initiative, or now it is called Global Partnership for Education. And all in all, by 2015, Moldova will disperse $13.2 million US. And again, using evidence-based advocacy, we have managed to convince the government to use solely all this money only for the revitalization of the ECD subsector. So, this is a grant. This is not alone. And the major objectives of this grant are as follows. To increase, first of all, the enrollment in ECD programs of all children, especially of children with special needs. To increase quality of education, and which is also very important, to consolidate partnerships around ECD. I'll skip this. So, which are our major achievements? Starting with 2006. Increase in enrollment, and we still have disparities, but there was a good increase in rural and in urban as well. Here you could see the positive trend. We collectively decided to have interventions at policy level, institutional level, and community level. So, at policy level, we started with development of child-centered policy documents. I don't know whether you know or not, but in Soviet times, when you used to be a part of Soviet Union, we had teachers-centered methodologies. And actually, we had great debates when we started the development of these new child-centered curriculum, early learner development standards, professional standards for educators, in-service, pre-service curriculum, and, which is very important, we have managed to institutionalize regulations for community centers. Moldova is a very poor country, so in order to reach the unreached, we do not have the necessary funding to build new kindergartens, which are not cost-effective. Therefore, we were trying to apply innovative approaches. So, we have managed to build the capacities of the staff who have not benefited of any kind of trainings for a period of 15 years. So, 100% of managers and methodologists were trained on child-centered methodologies, and 1/3 of educators were trained on child-centered methodologies as well. In accordance with the data provided with by the Ministry of Education, almost 90% of preschool institutions are applying new policy documents, and about 60% of preschool institutions have developed professional plans. Now we are in the process of institutionalizing mentoring. I forgot to mention that along with policy documents, we have also developed new didactical materials. All policy documents, along with didactical materials, were distributed free of charge nationally, which enriched the learning environment of kindergartens and community centers. So, one of our objectives was also to reach a social change. So, in accordance with the findings of one of our CAP institutional studies, changes in mentality of parents, teaching staff, and representative administration regarding early education occurred. We have managed to do a great community mobilization campaign, and all kindergartens which were renovated and all community centers which have been set up benefited of about 15-20 financial contribution on behalf of community, and in kind as well. We have managed to establish or set up 30 community centers in the most marginalized localities of our country. Approximately 40% of our ECD institutions were endowed with furniture, didactical materials, toys, etc., etc. We have managed to renovate one kindergarten in every district. We have 34 districts in our country, so the purpose of renovating one kindergarten in every district was to have a knowledge hub in every district. So, starting with 2006, we did a lot of research, and with UNICEF support, there was carried out an ECD knowledge attitudes practices study, which has an equity focus. This is very important because the findings of this report were used later for better programming and were used also for advocacy. So we generated evidence. What does it mean? We have documented our experience in FTI, our lessons learned, and we have used this experience of ours to develop second and third tranche. You should know that when a country receives such grants, they are conditioned. you received first tranche of 4 million. If the first tranche is implemented in a transparent manner and you could justify the use of funds, you will receive the next tranche. So, our experience was widely shared with Kyrgyzstan, Turkey, a lot of conferences. Actually, we have a lot of interesting information on our website. We have all our policy documents there, all our educational materials, all our activities, etc., etc. So, since 2010, Moldova's experience was recognized internationally. And here, you have Robert Zolik, who is the president of the World Bank. You have also the head of the FTI Secretariat, Bob Prouty, and a lot of, this is our Prime Minister, a lot of high officials from the World Bank and UNICEF who are present at the opening of one kindergarten, which was renovated with our support. This was a great opportunity for advocacy and for raising the status of ECD within the country. Sorry. So, this is how our kindergarten looked, or community centers looked before renovation and after. Water and sanitation, toilets. It's a great problem for Moldova. 1/3 of our kindergartens still have toilets outside. So, this is how they look. These are our interventions. So, before setting up a community center, we used a set of criteria. Before setting up a community center, we used a set of criteria, and one of them is Education Deprivation Index. So, in 2005, we had a lot of evidence that 1/3 of our localities do not have kindergartens. And even in those localities where we have kindergartens, they cannot provide access for all children to ECD programs. So, given to the fact that one of our goals was to improve and increase access, we started looking for alternatives. And that was the time when UNICEF, jointly with UNESCO, piloted for the first time in the country the first community centers for children and their parents. So, this project of ours benefited of an external evaluation. And the major recommendation which was provided by the international expert to the government was to scale up early childhood education services through community centers because they are cost efficient. They are twice less expensive than kindergartens. But we have learned a very important lesson after we have tested the first community centers. They are cost efficient. They have a low cost. But at that time, they were not sustainable because there was no legal framework, or they didn't have an official status. So, as a next step, in 2007, UNICEF, in cooperation with the World Bank, started to look for international consultancy to undertake a feasibility study. So, finally, we have hired École Nationale d'Administration from Paris, and the expert from that École Internationale d'Administration, together with a legal specialist and together with a financial specialist from the country, and of course, in cooperation with the Ministry of Education and the Ministry of Finance, did the costing of our community centers, budgeting, and legal analysis. This was a very important exercise. Why? Because as a result of that feasibility study, we have managed, with evidence, to convince the government, and first of all, the Ministry of Finance, that community centers are less expensive than existing kindergartens, and it's worth investing in them. Second, there were provided specific recommendations at the policy level, and as a result, the regulations of community centers were institutionalized. Once they were institutionalized, the community centers received the same status as kindergartens and creches. What does this mean? This means that local public administration, as duty bearers, they have the right to claim funds from the functioning of these community centers from central budget, because Ministry of Finance, while providing money from the central budget to Rayon level, they ensured us that they use the principle money follows the child. And it was so. But when the money reached the second level of administration, the Rayon level decided how to use that money. Meaning, if in a village they have a kindergarten, and in that kindergarten they have only 50 children, and in the whole village they have 100 children, they will transfer to the local public administration the money only for those children who are attending the kindergarten. The rest were used as they wish. Therefore, it was very important for us to institutionalize these alternatives. So, how much time? Half a minute? 5 minutes. Okay, I'll skip. We are part of a lot of fundraising activities. This is an IKEA project. Actually, it's a very interesting project because it was for the first time when we managed to do a socio-economic assessment of all 230 localities without kindergartens. Based on that assessment, an evidence-based training was organized for 1,400 representatives of local authorities, departments of education, civil society, on the basis of ECD, and on the steps how to establish community centers. And here you have the guide for local public administration on the steps how to use, what are the steps to be undertaken in order to set up a community center. It's very important because, first of all, you should have the decision of the local public administration, and then you should budget, and this is very important. Everything is important which deals with the budget. This project is also very important because we have a frozen conflict. Maybe you don't know. We have Transnistria, and this is a very good entry point for Transnistria as well. We also are making use of the structural reform. So in Moldova, demographic trends are decreasing. And due to that, the capacities of schools is empty. And therefore, in order to save money, we are setting up our community centers in the existing space of schools. We have one director, we have the same heating system, and this is a very efficient way of using money. So I'll skip. This is the flexible schedule community centers. Everything you want to know is that the schedule of every independent community center is linked to the needs of the community. So, what was the impact of our interventions? 10,000 children enrolled, including vulnerable children, and which is much more important, we have created opportunities for development for small, rural, disadvantaged localities. We have created around 900 of new jobs. So, we want to be inclusive. We are working towards inclusion. We want to change behaviors. We want, as an ultimate goal, to change systems. So, It's very important through our interventions to create opportunities for children from disadvantaged families to be in the same settings, same learning settings with their peers from well-off families. Why? Regardless of the fact that these children did not benefit of any stimulation at home, once they are in a stimulative learning environment, they start to develop their cognition. They start to think critically. They finally are ready to school. What does it mean? This means that once they are ready for school, it diminishes the risks of absenteeism, of dropouts, of neglect, of discrimination, etc., etc. So currently, our government has finally approved the National Program of All-Inclusive Education, which will facilitate finally the inclusion of children with special needs into the formal settings, main kindergartens, and meaning kindergartens and community centers. We've paid a lot of attention to Roma. We provide language assistance if needed through Roma mediators, and we always, during such presentations, we speak about impact at the higher level. I'd like to give an example on how our interventions impacted or make a difference in the life of a simple child. This is Ionuț. He lives in a very small village. He's Roma. And out of 500 of villagers living in that village, only 2 of them have permanent jobs. The others are employed seasonally in agricultural works. When I visited the community for the first time, they didn't have any social services. You just cannot imagine. They didn't have a kindergarten, they didn't have a school, they didn't have a health center, they even didn't have a shop. So usually when we set up a community center, we follow certain criteria. Here we had to make an abstraction, because one of the criteria is to set up the community center in a building which is part of public patrimony, public heritage. In this village, there was no public building, no one. So therefore, the local public administration rented a private house, which was refurbished by us. And when I first met this child, he was playing in the yard with this only toy. This is the only toy he had ever had. So, while playing with him, I realized that he doesn't know colors, that he couldn't name the days of the week, that he doesn't know the shapes. So, and he asked me, will we have a kindergarten? I said, yes. Why do you want to go to the kindergarten? He said, my grandma told me that it's very nice there. It's nice furniture, there are a lot of books, a lot of toys. My granny told me that once she has seen such a kindergarten over TV. And after a pause, he said, when I grow up, I want to become a teacher, to work at the kindergartens where there are a lot of toys and a lot of books. So I want to tell you that none of the residents of this village by now have graduated from a high school or from a university. Not all of them could hardly write or read. So hopefully Ionuț will be the first person from that village who will graduate from university. Is it all? So we do also leverage funding. So we have our last heroic deed was that we will benefit of $4.4 million on behalf of Global Partnerships for Education. We have also partnered with LEGO Foundation. Moldova's kindergartens do lack cognitive toys and books, and they donated cognitive toys for 24,000 of vulnerable children from 400 most deprived localities. And we have managed to convince them. And by end of June this year, they will provide cognitive toys, Lego and Duplo, for all our kindergartens and community centers. So we have also managed to raise money to fund leverage with Moldova Investment Fund, and this money will be used for water and sanitation. So lesson learned, we have managed, in order to achieve results, you should build strong partnerships. What is one of the most important lessons learned? Children left out of preschool are the most vulnerable ones, Roma, etc. So there is a special need to focus on parenting skills. I will skip. Quality. Increasing government funding in the ECD subsector should be accompanied by monitoring and evaluation of its efficient use. This is what I started my presentation with. Challenges. Moldova is the poorest country in Europe. IMF is imposing conditionalities for reducing budget in education. We still have huge disparities in enrollment between urban and rural. Migration. Another challenge is difficulty to recruit young teachers because they have no motivation. And there is no gender balance. I don't know what the situation here in Bosnia and Herzegovina. In our case, it's very serious. So, future step. By 2020, we'll try to ensure universal access to ECD services, focusing on the most vulnerable and partnering or strengthening our partnerships with the social protection. Currently, we are in the process of developing the referral mechanism. We'll expand ECD services to those remaining 210 villages without kindergarten by establishing community centers. We'll try to diminish the discrepancies between rural and urban enrollment. We'll enhance quality through training, through promoting inclusive education, and very soon we'll start. UNICEF will support the government to implement a communication strategy and a communication campaign on inclusive education. We'll try to learn and to convince the government to use the funds efficiently, to increase monitoring and evaluation, and to consolidate partnerships. And just 1 second. This is Dariana. She is 6-year-old, and she was diagnosed with Down syndrome. She was involved in one of the first of our community centers. What does her grandmother said, because her mother left 3 years ago for Moscow and she didn't come back. And her granny is taking care of her. Since Dariana began attending the kindergarten, her movements became steady. She can jump and run now. She can also sing and has even started to talk. I want her to go to school together with other children because education is for all. Thank you.